more about which occupations are at higher risk for infectious disease exposures. There are a number of different kinds of diseases, and we're going to group them into some categories. And so anthropogenic diseases are those diseases transmitted from human to human. So these are diseases or infectious agents that humans get, and we spread it to each other. And so this tends to include a lot of what we might consider to be nosocomial or healthcare-related infections. So some examples would be SARS-CoV-2, although we also recognize a lot of these examples have circulation patterns not just within healthcare settings, but also in the community. But SARS-CoV-2 and influenza are both viruses that are transmitted by respiratory routes. Human immunodeficiency virus, or HIV, is another virus, but that is much harder to transmit. But within healthcare-related settings, we worry about with needle stick, as well as hepatitis, which is a whole suite of different kinds of viruses, including hepatitis A, hepatitis B, hepatitis E. And then there may be colonizing opportunistic pathogens that are particularly stable in the environment, such as methicillin-resistant Staphylococcus aureus, or MRSA. So our occupational risk groups for a lot of these anthropogenic diseases include the healthcare workforce, so physicians, nurses, allied professionals, any health system worker, really in any role, including facilities and food service, could potentially be exposed, especially if we think about the respiratory viruses. Our waste management workers, both within and outside of the healthcare workforce. And then anyone who works with lots of people, and especially who works with children, because children tend to be at a stage of immunity where they don't have as much yet. They're still developing in terms of their immune system. And so they tend to be quite susceptible, especially to respiratory viruses or GI viruses. And so childcare providers and teachers are often at higher risk. You may have people who come together in small spaces, like airline or cruise ship personnel, often may have a lot of exposures. Although it depends in part upon the mitigation strategies within, for example, the airline. I think one of the biggest risk moments is actually when the actual plane is powered down on the tarmac before takeoff. Once you get the ventilation system engaged in flight, that tends to limit some of the exposures. But when you have things powered down, that is going to potentially lead to more drift within the airline itself. Of course, with cruise ship personnel, norovirus is a virus that, especially in the interior of a cruise ship, can survive for quite a bit of time. And so surfaces, as well as, other kinds of transmission through food, can be a really big problem. And then anyone who works in a crowded area, regardless of profession, might be at risk. This includes mass gathering events. I'm a veterinarian, and so zoonotic diseases are something I study quite a bit. And these are diseases caused by infectious agents transmitted from animals. It can be direct, where you have direct animal contact, or it can be indirect, so contact with animal products such as hides, meat, eggs, etc. And there are many different zoonotic diseases. We also consider that, 60 to 75% of emerging infectious diseases emerge out of an animal reservoir, like SARS-CoV-2 did. And so our example infectious diseases include a lot of viruses, like hepatitis E virus in pigs, avian and swine influenza virus, rabies, really from any mammal, as well as bacteria like Campylobacter jejuni and Salmonella, livestock-associated strains of Staph aureus, as well as parasites such as Cryptosporidium, which I've had personal contact with, and Toxoplasma gondii, which is something that is of highest risk for workers who are pregnant and have, the fetus as the potential target for the neurologic effects. So in this, your occupational risk groups are people like me, veterinarians, animal care workers, but also people who work with the products. So in animal processing, whether it's at the abattoir or downstream in terms of meat processing and packing. The people work with the animals themselves, so the farmers and farm workers. And this really, it can include crop farmers, in part because manure may be used on crops as a fertilizer, and in part just based on proximity to wildlife and to animal agriculture. you may have contamination of the crop fields, and that may be a risk environment. We can't forget that fisheries and aquaculture workers also have specific risks. And one of the ones I think about most here is Vibrio. Vector-borne diseases are those diseases transmitted through an insect or another vector. And so common vectors are mosquitoes or ticks. And this means that vector-borne diseases often can have a strong geographic component. So we don't see yellow fever everywhere. We don't see malaria everywhere, in part because of this tie-in to the specific vector. And so the climate has to be suitable. We also recognize that with changes in patterns of temperature, rainfall, etc., that there can be shifts in terms of the distribution of vector-borne diseases that we need to pay attention to. So some example infectious diseases would be West Nile virus, which is carried by the mosquito, leishmaniasis, so leishmania is carried by the sandfly, and Borrelia burgdorferi, which causes Lyme disease, is carried by the tick. Your occupational risk groups then would often have contact with these vectors, right, with the insects. And so your forestry and park service workers, any of your agricultural workforce, hunters and trappers, and really any profession that has a lot of outdoor activities. And so I think a lot about construction workers or people who work in transportation, where they may need to spend time outside, someone who lays cable for a TV company or one of the telenetworking services may need to spend a lot of time outside. And so we want to think about this more broadly. Finally, in addition to infectious agents, we may have other biological exposures that can have a strong kind of risk group. And so allergens are among these. And allergens are really any non-parasitic substance that induces an allergic response. And often this is host specific. So not everyone will have an allergy to certain kinds of things. So here's an example of mouse allergen in laboratory animal workers. And so this is a workforce that raises mice to be used in laboratory research. And so you might categorize them as being people who work in the facility but don't actually directly handle the mice, and those who directly handle the mice. And so you'll see that measuring the breathing zone, MUS-M1, which is one of the mouse allergens, shows that even the non-mouse handlers had some exposure, and there were some individuals with fairly high exposure, although exposure was much higher in the mouse handlers, as shown in these box and whisker plots in the lower left. In the lower right, we see it broken down a little bit more refined in terms of your job title. And so the admin and support tended to have lower concentrations of breathing zone MUS-M1. And of course, your animal care team had the highest exposure. But you even had people who worked in supplies who had really high exposures, possibly because of the mouse allergen being present on some of the things that they were handling. So that would be an indirect route of exposure. And one of the things found in this particular study by some colleagues of mine was that the cumulative exposure to mouse allergen was associated with allergic sensitization. So this is new sensitization in workers who came into employment not sensitized to mice. So how do we track this from an occupational health perspective? Well, we might think about using medical surveillance programs. These are any systematic program to evaluate workers who are exposed to hazards. And these can include both active surveillance as well as passive surveillance. Active surveillance are those dedicated efforts that we're going and we're getting information. We are collecting personal exposures, we're collecting ambient exposures, we're collecting biospecimens, whatever it is. And so one example of how this may be used, we see this a lot in workforces that have particularly hazardous infectious disease exposures. So in certain biosafety level 4 and 5 workers, you may do paired serum samples at work entry. And then if there's an event, you can take a sample at that event point or upon exit from employment to see what the seroconversion would be in that particular employee. You may have more passive systems that are based on reporting of disease events or syndromic surveillance. But you may also have targeted activities that are related to either known or suspected exposures. And so the first example is also a personal example because I was vaccinated for rabies very early in my career, since I've worked with animals for a long time. And this typically is required for people who have a lot of animal handling as part of their job. And then it's recommended that we retest our titers for rabies to make sure that we don't need to be boosted in terms of our rabies vaccination every 2 years. I will say that I was vaccinated in high school, and every time I had my titer taken, it has been a very high titer, so I've never required a booster. So I may be a bit of a unicorn, or perhaps I am someone who has had inadvertent continued exposure without my knowledge. So it's a good thing that I've had the vaccine. Another example would relate to periodic testing for sensitization to workplace allergens. And so this might be in a laboratory animal facility, testing for sensitization to MUS-M1, periodically, and then taking steps to provide additional protection or alternative work structures for those who develop sensitization, given that exacerbation can be pretty severe in some workers. Some medical surveillance programs also will include environmental exposure assessment to understand the nature of where you might have your riskiest exposure. There are also sort of this concept of sentinel health events. And so these are any preventable occupational health outcome whose occurrence shouldn't happen, right? So it signals a need for intervention. The examples may be specific, right, to different countries because some diseases are more prevalent in some countries and may not be specifically a sentinel event for an occupational health need. But certainly if there were a veterinarian in the United States who contracted rabies, that would be a sentinel health event because veterinarians should be vaccinated against rabies and having their titers tested on usually a biannual basis to be sure that they are high enough so that if there is inadvertent exposure, that they are protected. Other examples might include anthrax or brucellosis or tetanus. Again, things that are either vaccine preventable or should not be an exposure in the occupational setting.